Tracey Veal is a healthcare strategist with a passion for leveraging analytics, technology, and innovative partnerships to drive transformational improvements in disease surveillance, healthcare access, and health outcomes. Tracey improved delivery and community engagement at national health plans, hospitals, and providers by aligning public and private sector with community-based approaches. Tracey was a FUSE Fellow with LA County Department of Public Health 2021 during the height of the pandemic. Her project was to ensure an equitable, effective, and safe distribution of the COVID-19 vaccine in LA. And so it is not an exaggeration to say that her fellowship was transformational in so many ways for how public health is delivered in LA. She recruited people from vulnerable communities for a county equity committee and urged the state to direct 40% of vaccines to impacted communities. Dr. Tracey Veal also led the planning and implementation of distribution efforts during the pandemic in LA, with over 11.6 million doses administered to 74% of LA County residents, the largest distribution efforts in LA's history. Dr. Tracey Veal has a Ph.D. in Public Health Administration from Capella University, an MBA from Clark Atlanta University, and a BA from Agnes Scott College. And with that, I will welcome Dr. Tracey Veal, and the floor to you, Tracey.
Oh, thank you. Well, it's great seeing everyone. I know it's Fantastic Friday, so I will try to be brief and to the point and share whatever knowledge I have. So the first thing is thank you for taking the time out today. I know there's other things you could be doing. And what I'm going to do is share my experience and some other learnings I've had around community engagement and building really meaningful community relationships. In my case, for this particular project during the pandemic, when LA County was the epicenter, it was a rapid response. So we really had to build efficiently and fast. So what I'm going to do is try to give you kind of an overview of some of the objectives and how we use some of the FUSE framework to leverage getting this done, and how the history of mistrust has to be accounted for. And then some community assessment and action examples. Some will be environmental, some will be from different sectors that I've dealt with. So hopefully it'll be meaningful for you. The first thing I want to start out, I'm in Atlanta and I'm actually across the street from the jail where Martin Luther King was jailed when I was a kid. And I thought about this, and the one thing he used to say is our lives begin and end the day we would become silent about things that matter. So if it matters to you, it probably matters to the community. So just making sure that the people from the community are at the table is sometimes a battle in the government, but it's very important for their perspective to be heard. And that's what FUSE fellows are able to do. And for me, just identifying what actions and what activities will lead to community relationships is important. Even in rapid responses, who knows who and how do we go about it? And just being very clear when you go into these communities about what is the history of mistrust, and understand what it is that is causing people to mistrust, so that at least you acknowledge the issue. And here's an example from my experience. Public health originally was trying to get people to come to vaccine clinics in some of the parks, and people would not show up. And what we found out was the people who deport you, ICE, would be in those same parks, and the folks would not come to those parks because they thought ICE would be there. And I guess people hadn't done their homework, and they would have known that and picked some other venues. We were able to pivot from that, but if you don't go into the community and find people who can give you that history, you kind of miss out. And when a person of color is dying every 5 minutes, you don't have time to go backwards. So that's one of the learnings, is just find out what the trust level is in that community. And I just want to remind folks, and I know you all know this backwards and forwards, because I get a lot of people going, well, it's equal, Tracey. We gave everybody the same thing. But as you all know, and this is a clear delineation between equity and equality when you think about your stakeholders and community engagement. Equality, everybody does get the same. I'm sure you've seen this a lot. No matter what your disability or your need is, you get the same thing. So this is the bicycle from Robert Wood Johnson Foundation, where everybody gets the same thing, regardless of need, regardless of whether it's right for them. That sounds great, except for that's a problem. what equity does is to each according to his or her needs. So as you can see at the bottom, you've got all these customizations for based on people's needs. And it's the same thing with equity. And I know you all know that, but when you're looking at stakeholders, here are some examples. When I came to public health, there was this big focus on let's get these drive-through clinics up and running so people can just drive through. Unfortunately, a lot of people didn't have cars in the communities that were the most impacted. And also, when you think about environmental health, one thing that happened, at least in South Atlanta, some other areas, was that people were standing outside in the bus shelters and they're getting, it's 110 degrees at times. And they put the bus shelters in other places. And so it was like, okay, that's not really equal. They said, well, we're putting them out there. So it's equality. That's not equal. You really need to, they have fewer trees. They have the least tree canopy in the nation, in the region. So you need to think about how does that impact people, right? And then equity. Like I said, we ended up doing mobile vaccine clinics, walk-up clinics, ignoring and privatizing appointments since people didn't have digital access, so they couldn't make appointments. So we did a lot of workarounds to get people vaccinated. We ended up with 95% of the seniors vaccinated and over 80% of the entire communities in those areas, but it was a stretch. But what made the difference was the community relationships that we did rapid response building. So I'll pause there to see if anybody has any questions or comment or experiences before I go forward. And I can't see raised hands, Yerman, so you'll have to see if there's anything. Okay. Okay, well, I'll keep going forward. And one of the things that I think is useful is using the Fuse idea framework, which they familiarize you with all these models, but this one specifically does focus on inequities. And inequities, and to address inequities, you really need to ensure that your community engagement is a part of that. So if you look here, the E is, which is engagement, is really making sure that the resources and the people at the table are really being heard. And I know for me, all of a sudden, it was a political great thing to do to be on this equity committee. So politicians and key people sent 150 people to me to be on a committee. And there is no way you can get a lot done. So what we did was we did subcommittees and we had a core committee. And that kind of was the way we dealt with the political issues around who wants to be on this committee or not. And we broke it down that way. But at the end of the day, the most powerful committee was the most diverse one that had not only physicians and clinicians, but politicians and community folks from the areas that were underserved, and also a lot of diversity in terms of age, class, and all kinds of things. So that was probably the driving committee that made the difference. So just engaging not just the voices that people direct you to, but maybe going outside of that. Because at one point we didn't have the data the way we needed it. So I went to the academic institutions and they became part of it, and they had rapid response data analysis that we could use that ultimately helped inform LA County's way of approaching data. So that's one of the biggest learnings. And I would advise you to kind of look at some of these tools that you were given, like the Fuse Measurement Guidebook, because there are some tips in there about community collaborations and stakeholders that align to your focus population. And I know when we were doing listening tours, at first we were told to do certain ones, but then we missed like the hospitality industry. Those folks work around the clock, so we had to do midnight ones. We also missed certain stakeholders. So we had to do something that was non-traditional listening tours at places and spaces that you, like we did swap meets, we did meat packing plants. Meat packing plants did not want us in there, so we had to go across the street, have taco trucks and food things, and offer that in order to engage with the folks who are dying the fastest from COVID. So sometimes it's going around the norm to make sure that people's voices are heard. And then a lot of the community stakeholders had access to other voices. So instead of having that politician, it was who's doing some of the work on the ground, and they would refer us to a person. And then just making sure you covered all the bases. On the screen, you'll see these two logos, and these are samples for environmental health and things that are going on in South LA. One is a big major trust in LA. Another one is a smaller one. So my learning with community-based organizations was to get some of the larger ones, but also to make sure we get the small community ones. And what we were able to do with that was, when I kept hearing, we don't have any money for this, we don't have any money for this, we were able to generate significant philanthropic support for our efforts by having big and small, because the big ones knew people, they had marquee names, but the smaller ones needed that funding. And we ended up with a program called Grassroots Grants, where we had all kinds of churches and community organizations that normally would not get grants, got grants in order to open up their community centers and everything else to support the vaccine education, to support food drives, to support all the basic human needs beyond just a vaccine. And some of those organizations had never been able to get grants. So that actually fueled a lot of what we were able to do and do well. And the other thing is, like I was saying, just making sure you cover all the bases. You think about things in terms of like climate change, right? What else does it impact? Well, if you look at my arrow at the bottom, is climate change impacts a lot. It impacts a person's health. A lot of places have never had air conditioners in parts of Los Angeles because they didn't need them. Well, in LA now, they are giving away air conditioners, but they didn't have those. So people were literally and trapped in heat. We had so many emergency room calls at certain parts of the year now. And also, is it fair to have people in these communities in some of these government projects that didn't have air, should not have been accounted for now? And then education, we had schools that we would measure the temperature in that was over the top, right? So how can you even do a vaccine program when people are literally dehydrated and it's too hot? And then housing, I can't tell you how many housing units I've been to where there may have been 8 to 10 people in a 1 bedroom. And what does that do? That's an issue in terms of something like COVID, which is very passable, which is why those communities were hardest hit. So that needed to be addressed. And then there's jobs. When we decided that we would get community healthcare workers, one of the key things was to make sure we recruited from the communities that were impacted and served and that we needed to serve. So it was other jobs that came from that that interest, meaning whatever we can do to help those communities have some of these jobs is what we're going to do. So when you think about climate change and all these others, think about the continuum of all the touch points and what the outcome could be at the end to help that community. And some of those jobs, we have a significant number of community health workers that now even work with health plans, and we've gotten them certified and trained. And LA County continues to have a huge faith-based initiatives from the 400 churches. I originally was doing 100 churches in 100 days, and I ended up with 400 across every kind of religiosity that you can imagine. So that is still going today, and it actually helps support a lot of other initiatives beyond what we initially started with. So I'll pause there to see if there's any other questions or comments as well. There's something in the chat. Okay. Oh, the guidebook. Someone's using it. Great. Thank you for that. Okay. Well, going forward, and I'll give you times for other questions at the end of this, is some of the other learnings about creating community relationships. One of the things when you think about climate change that people don't think about is some of the demographic historical influences that you really need to make sure you know about in these communities. For example, most people don't know this, that California is the state with the second most sites on the EPA's Environmental Protection Agency's national priorities list. There are 96 total ones in California. 17 of the country's 96 most polluted sites are in California. So when you do your homework, I would just say, don't just look at what is given to you, go beyond that and see what else you can find out about the history of that community. There's a pretty interesting history about how Dodger Stadium was built and how it displaced people. So there are things that are not at the forefront anymore, and there are a lot of other issues too. For example, when we were doing COVID, a lot of people were dying in the prisons. We had people who were in the LGBTQIA community that said nobody would give them a vaccine. So we had to address a lot of different biases around amongst people. Who should vaccinate me? Do they look like me? Do they not? Do I trust them? Do I not? And then some people say, why are you doing homeless when all of the rest of us need help too? So it's sensitive, but you have to account for whatever you can and do a few things and do them well, but let other people help get the work done for you by engaging in the right community relationships. And other ways that we look at to establish some of the equity that was lacking was the trusted messenger. Some people had never been to communities that they were assigned to. So when they showed up there, the community didn't know who they were, nor did they want to engage in any type of surveys, listening session, or even support. And what I made sure I did was include other people beyond the government entities. Academia, community-based is important, but there are also some unique ones that may be culturally appropriate. For example, for the tribal nations, we have a significant number of folks who were engaged to help those communities. They didn't want regular people coming into their area, so we engaged with tribal communities. They would have ceremonies and do an ancestral thing, and that was important to them. And also just polling the residents, people just coming into communities, knocking on doors, trying to get information wasn't the way it needed to be done. So those community health workers that were already there and those that were not already there, that lived there, were really critical to make sure we, engage with the community in the way they wanted to be engaged with. How, why, when, and whom was engaging with them was important. And then determine who's already in that space. So when you look at a community, whether you Google it or you look on Instagram or whatever, who's already working in this space so that you can collaborate with them versus just, coming in with the solutions, which happens sometimes. The context of the Superfund slide is really because I was in DC at the EP and I have a close friend there. And a lot of the communities that are hit hard are underserved communities that have a history of mistrust in California and the greater LA and other areas. So it's like consistent and persistent disenfranchisement because these folks are where a lot of the industrial plants are built. And at the time, it's just those communities that are lower income who cared. So that's the context on the people who made a difference in getting reparations for all of that. You can never kind of fix that once it's done, but are those people that were advocating from the community that kind of came together with some advocates that pushed forward, like the Exide plant, where I had friends who their whole family had leukemia, but they never made the connection with the battery plant. Once that research was done in academia and with the government, the next step was getting advocates who really understood what was happening in those communities. Most people who lived there didn't even realize they were being impacted until so many clusters were popping up at certain hospitals showing how many family members in a particular zip code around that plant were getting leukemia and other conditions and losing their hair and all kinds of things. So that's where community advocacy matters, but they needed to have other advocates to help them get the reparations and the focus really that went on for years. I don't know if that answers the question or not, or yeah, okay. So that's just one example where if the local advocates had just kept doing the same thing without any advocates from academia and the government, it never would have came through because there was a battle. A lot of those people were immigrants. They were not used to positioning their needs in a way that was meaningful to make action happen at a higher level. So hopefully that kind of explains that. So one of the things that I talk about is we talk about history, what current projects are going on that you might be able to, leverage. and who's sponsoring some of those projects, and is there representation across the board, not just diversity, but age, because some of the things that we were able to get done were because some of the younger people, like I'll do the text messaging, I'll help build this or that on social media. So it's really making sure you have the spectrum of age groups in addition to the other representation. And the one thing I will tell you, the biggest learning is to leverage what is already there. Instead of creating vaccine events, I said no more vaccine events as a standalone in these communities. We needed to engage with others who are already doing things, whether it was food drive, vouchers for rent, uh, helping people with their utilities, all those things. So once we did that, we got much more groundswell and built better community relationships with others that were trying to reach that same population to help and support. So I say, look and see what's already there. Even when we were doing the listening sessions and surveys and things like that, others were already in that space doing certain work. So we were able to leverage that. And it also helped us from a budgetary standpoint. So we didn't have to do everything ourselves from scratch. So hopefully that makes sense to you. And then some of the questions that I asked, who knows somebody who knows somebody? Do you know somebody who does research and surveys in this area? Who reports to whom was important? Because, for example, we would get these calls from the White House, and it was important to know. So there was the White House, then there was Governor Newsom, then that was the county, then that was the city. So you had to kind of know the chain of command and leverage some of those leaders. So a lot of the work that pressured Governor Newsom into allocating vaccines equitably, since they came from the White House to Governor Newsom, or a lot of other people who worked amongst his teams, as well as physician leaders who were White House advisors. So it's who are the leaders that are impacting those areas. I went through and said, who's a White House advisor, who's aligned to the state, and that's how I picked some of the leaders to be on those committees outside of just the community advocates. And then I had to make sure when we were dealing with the politicians, and some can have egos. So they were like, well, I need my face on the flyer. And it's like, well, there's a price for that, you know? So it's what's in it for me. You have to account for it. And it was fascinating to see when you say, well, we don't usually do, photos of the politicians or whatever. And the next thing I know, I said, well, that's going to cost you a little bit more. And here's what else we need. And they would pony it up. And I'm not a snake salesman or salesperson or anything, but I was fascinated by the fact that it was always what was in it for me. For some people, other people just did it out of the goodness. So I leveraged both when necessary. And the other thing is, when we were approaching some of these stakeholders, they wanted to know about the data. Why are you picking these communities? Why aren't you doing broader? So we really had to make sure we had our data laid out really well and time things really well in terms of positioning what we needed to that leadership and prioritization. Everybody got transparency around who's having the worst, where's the worst impact, right? So that's one of the things, to make sure you have prioritization and representation for those prioritized areas, not just kind of a broad swath, which is what I would have ended up with 150 people, but we needed to make sure the voices of those communities that were most impacted were heard. And then some of the options, just integrating everything in terms of equity, in whether it's, we had to do quite a we had to do a lot of virtual, so it was important to make sure that we did not just virtual, we did a lot of different types of outreach to get the information we needed. Listening tours were not enough in that case. We had people who did not want to be on screen, and then we had to go physically to places, even in grocery stores and places like that. So who is needed? The way I broke down my particular project was started out with who's got the power, right, within the government. That was important. And sometimes they have stakeholders they're familiar with. But the other really important thing, when people are like, well, we're going to build a dashboard, and okay, that's fine. who's doing that work, because we need to make sure that it's communicated in a way that is understandable to those communities we're serving and their stakeholders. For example, if they're low literacy, it needs to be very visual. We had to do them in language, and we had to do them considering the visual imagery that resonated with those communities. What you might do for a tribal community is very different for what you might do for other types of communities, whether it's Asian, Filipino, different languages. It all looked very different, but it was the same information, but it was relevant to that community. And I'll show you an example of that. And then who are the influencers in those particular community that may not show up in the government list? I always look in the media to see who's relevant to that community, who's raising their voice in that community. And that's the other way. I actually did some cold calls to call some folks by looking at the media and the social media that was out there to figure out who was making impact. And last but not least, who else do you need? And when I kept hearing there was no money, I started researching what philanthropic organizations are aligned to what we were trying to do, whether it was think tanks or philanthropic organizations. And that's where a lot of the funding came from, which was extremely helpful. So I'll stop there to see if there's any other question before I go to the whole data part of it, which is got its own kind of life. So I'll stop there to see if there's any other questions. Let's see, there's one in the chat. Oh, a great checklist. Yeah, and you'll get this PowerPoint when we're done to see if there's anything that's useful for you. Okay, so we talked about internal stakeholders, which for Fuse, you always start there because you've been embedded in the government entity. But the thing that I learned about that is just not enough, particularly when they were advising me, here are the 150 people we want on this committee. And that wasn't going to work. So I had to find a way around it. And the processes, who is actually doing the data? And like, that wasn't disaggregated data. And there also, interestingly enough, was not data by ethnicity, which is kind of critical when you're looking at philanthropic organizations and the impact. We looked at the impact clinically through that lens, but we weren't able to do that initially. So there was a lot of work that was done here that actually helped us engage more of the community and more of philanthropic efforts, as well as more stakeholders who are genuinely interested in supporting that. And then the next thing I looked at is who's on the outside. I mentioned earlier about looking at social media and news to find who those people are, not just take it as what people tell you. It's okay to have the internal stakeholders from the government to inform you, but you might have to do some additional folks or find a way to at least engage with some of these external stakeholders that are having impact in those communities. For example, people wouldn't show up for certain times of day. And we found out that there was a lot of people who worked in a particular industry and they worked the night shift. So we switched how we were doing things, and we had more males that came out to this vaccine clinic in Compton than we had ever had for any location. So it does matter knowing that community or knowing people who know the people. And then a couple of other things, I talked about philanthropy already. But the other thing is, how are you going to report your milestones and outcomes? That is where a lot of times the community engagement is written up, but it's not part of the actual final reporting. And I actually did it a little differently. We did include the stakeholders from the community as well as all of these other stakeholders in the final reporting. It was quite the task, but it was worthwhile work because it was applied and meaningful and allowed that rapid response that we were able to do, and the infrastructure that's still in place today. So it was kind of a maze to me when I first got there. It was like, how am I going to get through this? But here's an example of where we had to pivot and deal with the issues with the LGBTQIA community. And the first thing I did was, yes, I went on social media to see who's doing what. Also, a lot of these large organizations, we married them to the smaller ones and were able to do these massive vaccine activities in those communities at the events they were already having. And it made a huge difference because we also did training in culture sensitivity. We found people and volunteers and paid workers that we were able to engage to help do this work that looked like the people we serve. So we had a huge uptake, and then we were able to map and say, here's where we have issues, here's where we have the need, what do you think? And they were all in once they were able to see what the case rates were, what the impact was of what they were doing over time. So we kept in communication to let them see how we were doing in some of these areas like North Hollywood or other areas. And the dashboards, this is what the dashboards look like on the LA County website. But like I said, we changed those to really resonate with the communities we served, and they were anxious to get that weekly update. So this data informed is really important for building the stakeholders. Are you in the right place at the right time with the right people? And then the outcomes reporting that I mentioned, doing it in a way that is meaningful to those communities, not just the internal stakeholders. And what are we going to do about the issues that come up and how we're going to go about it? Those stakeholders were very forthcoming in helping with solutions and resources to the extent they could. And then the ongoing feedback. It wasn't like a one and done. We allowed those different customized visual web trackers to be on an ongoing basis so those communities could really see what was happening in theirs. And then who's missing at the table for those areas that we targeted in terms of where we think the worst impact is. And it's the same thing with the environmental health or any other thing that you think. This is kind of a recipe approach that I've seen for many years. So here's an example of another equitable approach. So we called this the Blackboard. Yeah, I made that up, but that particular Black community where people were so fearful of even getting the vaccine, we had to do something very different. So we ended up with an entity, if you can see on the screen here, we called it Black Vax. We did this for different ethnic communities that were in the hardest hit areas, and they all came together to pull forward. And in Compton, like I was saying, we had more people turn out than we anticipated. And I had students make these shirts that say straight out of quarantine. They put them on social media and people were showing up to get the shirts thinking, you know, it was a prime thing. We actually ran out of those shirts, but the students drove this from the schools, from the elementary schools and the universities. They helped drive this. I just had them design it, and they used some of the funding from a source that helped print these for a lot of other activities they were able to do on vaccine education. And then we made sure that in those communities that we utilize those providers and funded their efforts in those communities because people were familiar with them, and they came out and would talk to those doctors about all kinds of other things, and they were very comfortable with that. Particularly like mental health was one of the issues. We ended up training people on mental health first aid, and they got funding to do that work because there were a lot of mental issues at the time, and there was, you know, people who didn't have an app, that the free AppCom app was available, but they didn't have that. So we were able to do a lot of this work by really focusing and customizing to like maybe the top 5 communities and ethnic groups that we needed to serve. So hopefully that gives you a sense of when you come together, and this is rapid response. It's not like we had a lot of time to build this, but we put a lot of this out there to the universe with some key people, and they helped get it done. And finally, this is the outcomes part of it. What does this report look like? We had a guiding principle, which was a quote from the poet laureate Amanda Gorman, for there is always light if only we're brave enough to see it, if only we're brave enough to be it. And there were some dark times, so we needed something to help lift us up, all of these different subcommittees. So we pulled together and presented this in February, but we worked on this all throughout the rapid response. So we presented it to the Board of Supervisors. Other states and counties came forth to get this report because it has a lot of best practice and recommendations. We were not able to do everything the way we wanted to, but some of the things that we did was just inform this with some of the interviews and a lot of the other research that we did in categories that were really important. So there were sections that were about the different communities that we served, what some of the barriers were, and then there were solutions. What did we do and what would we do if we had more time? Because a lot of people were pretty resistant initially to taking the vaccine because of disinformation and misinformation. So we didn't just say, here's the population, here's the barriers. We had a whole solutioning, and we were able to implement probably the top 2 or 3 from those categories, but at least it's out there and it lives in infamy. So what is it that you could take away from this? What will you do to maximize impact differently from hearing all of this? And just confirming that data is really not just kind of one siloed place, because if I had just taken the data from public health, it wasn't enough to make the impact initially because they didn't have some of the key information. And just making sure that the external stakeholders are engaged, as well as if you need to, you may have enough funding, but we never did. And just making sure that not only do the internal and external stakeholders get the outcomes report, but the philanthropic organizations needed to know what impact we were having on an ongoing basis. So some of the students from some of the universities, graduate schools, undergraduate schools, were able to help us communicate that out on an ongoing basis. So it wasn't all on us, and we had a template, and they were really great about creating visuals that like infographics on, what was happening real time. And the students thought it was one of the greatest things they were involved in, but they were extremely helpful.